Hello, my name is Elizabeth Michaud, and I'm a nurse practitioner student at Auburn University, and today I'm going to be presenting on Hydatidiform mole. A Hydatidiform mole is also known as molar pregnancy, which is a gestational trophoblastic disease resulting from abnormal fertilization. It can be partial or complete. In a partial mole, the mother's chromosomes are present along with two sets from the father, resulting in 69 chromosomes versus the normal 46. A partial mole has evidence of an embryo, meaning some fetal development has occurred. It is also benign in nature. With a complete mole, the mother's eggs are lost and the father's chromosomes duplicate. A complete mole shows no evidence of fetal development on the ultrasound and a higher chance of becoming cryocarcinoma, which is a malignancy complicated by metastasis. Risk factors include previous spontaneous abortion, maternal age of less than 20 or greater than 35, and previous history of molar pregnancy. The rate of occurrence is 1 in every 1,500 pregnancies. 3 key questions to ask your patient. So we want to know whether they're having severe nausea and vomiting because this is a common symptom with molar pregnancy. We want to know if they're having any vaginal bleeding and what the vaginal bleeding looks like. We would expect them to be passing possibly grape-like cysts. Also, ask them the following, if they're having any of the following symptoms: high blood pressure, swelling in the lower extremities, or severe headaches, as these are signs of preeclampsia, and that's common. So you can have eclampsia that can develop in the second trimester of an untreated Hydatidiform mole. For physical exam and diagnostics, we wanted to perform a vaginal exam on this patient to assess for large cystic ovaries. This can be common with molar pregnancy. We also want to perform an ultrasound like we do with every pregnancy, but on a molar pregnancy, we would see like grape-like clusters with or without a fetus present. And then we would want to do serum lab testing, which is a blood test for beta-HCG. It's normal to have beta-HCG within your system if you're pregnant, but in molar pregnancy, it's a lot higher. It's greater than 40,000 milliunits per milliliter. So here is an ultrasound of a complete mole. As you can see, there's no fetus present in this. You just see the grape-like clusters that are up towards the top. And then over here on the right, we see that there is some sort of fetal development, but also over beside it to the left, we see the grape-like clusters on the screen of the ultrasound. Treatment options. So we would do a D&C, which is a surgical procedure to evacuate the mole from the uterus. And then for patients who have completed their childbearing years, we would possibly consider a hysterectomy. So as far as patient teaching, we want to educate them that we're going to be doing weekly serum beta-HCG levels until we have had 3 consecutive levels that are less than 5 milliunits per milliliter. And then once those have been obtained, we would do every month for 6 months to make sure that those don't spike back up. Also, we'll tell the patient to wait 6 months before attempting pregnancy again following the molar pregnancy, because we want to avoid confusion as to what is causing the elevated beta-HCG levels. Is it from the new pregnancy or occurrence of the cryocarcinoma, which would spike up the HCG levels as well. With a pregnancy following molar pregnancy, we want to educate patients that they need to have an ultrasound in the first trimester to confirm that the pregnancy is in fact normal. And these are my references. Thank you so much for letting me educate you on Hydatidiform mole.